When you first get your equipment in your Batforks, when they come from the factory, may have a very thin film of oil on them. And so you want to wash them with a good detergent first to get off any oil residue that might be on the Batforks, so that when you put your compound tabs on here, they'll stick to the Batfork good. I'm going to wash them now with just some hand soap. So I'm going to prepare the Batfork here with using the compound bat tabs. If you look at the Batfork, you'll see a center line here. So we'll want to put one of the bat tabs right on the center line. That would be on our incisors. And we're going to put one in the area of the left first molar. And then in the area of the right first molar. So that our Batfork can be prepared ahead of time before our patient comes, and we don't have to spend patient time preparing all of this. Now, I'm going to demonstrate one other thing. In some situations, we don't have the bat tabs available, and so I'm going to use Greenstick Compound. I'm going to illustrate this just by putting some Greenstick Compound in the area of the central incisors here. To do that, we need a flame, and we'll gradually heat the Greenstick Compound. And you have to do it 2 or 3 times to get enough on. Once you've built up some like this, you need to then shape it a little bit. So wet your hand, put it in the water bath for a second, and then you can take your hand and begin to shape it. And you'll notice that if you want to, you can push it so that it would come through the hole here, and that would lock it on. So the holes tend to lock it in position. And then we would do also in the molar areas here, so that we would prepare a Batfork in that manner ahead of time. Now, the other thing that we can do ahead of time before the patient comes is we can prepare our Batfork, our ear bowl assembly. Number one, we've sterilization or cleanliness. We put these covers on the ear hole tabs there, and we put our Nasion relator on, and we put our Batfork assembly on here. When you do this, you make sure that all of this is nice and loose. It will move up and down the arm freely, and the toggles here move freely. And so we can have this all prepared for our patient before the patient comes. So we would prepare our models. We can have our models all ready to go before the patient comes. So on one appointment, you would take good impressions, use a rim lock tray so that you get very accurate models. It requires either perforated or rim lock trays in order to get accurate models. Also make sure that all the bubbles are removed, and then we can be able to seat the models very clearly into the bats correctly. Okay, now we have our patient here. And the first thing that we want to do is that we want to check our patient as far as the overjet-overbite relationships, so that when we take our bites, we'll know how to place our wax bites. But before they do that, I would just want to do a quick check on this patient for a moment and just check the joints and see if I can find any discrepancies. And so to do that, I'm first just going to palpate the masseter muscle area and ask the patient if it's sore. She's kind of wiggling her eyes, scrunching her eyes up a little bit. So she's feeling something. Then I'm going to go up to the temporal for a second and just check here. And next thing I want to do, just very superficially, I'm going to have her open and close, open, close. If you look very closely when she opens big, you'll notice the jaw deviates to one side. Open, close. And also I feel a clicking and popping in the left joint. This patient, I find out, she tells me she's been on a splint for a month now because she was having headaches. And so after wearing the splint for a month, the headaches are gone. But we would still continue her splint until we get the jaw stabilized and potentially, hopefully, eliminate the clicking of the joint and also the deviation in the jaw movement. But from taking a bite standpoint, what I want to look at first is the dentition. And from her models, I've looked at her models. Open big, please. She has beautiful alignment of the teeth. And now raise your head up. And the same in the upper. Very, very beautiful alignment. We can see attrition. If we look very closely, notice the cuspid here. You can see the attrition on the cuspids. So we know immediately that she's got interferences on the left side. We know that there's balancing interferences on the left side when we see the attrition on the right cuspid. So we'll see if we can demonstrate this on our articulator once we get our mounting made. Because we also now will have our patient close slowly. And we take a look at the dentition, and she closes in a good class 1 relationship.
I can't see that. Still really can't see that.
Okay. Take my word, she closes in a good class 1 relationship, both right and left sides. And the midlines line up good in centric occlusion. There is about a 2 millimeter overbite and almost a 0 overjet. So she just barely has a little bit of an overjet. So in preparing our wax bites, the first thing when I'm preparing my anterior portion of our power-centric bite, I know that there's no overjet. And so I don't have to worry. That tells me how wide I make the anterior-posterior part of my power-centric bite. In taking your bites, the first one you want to take is your centric occlusion bite, which I'm going to prepare now. I generally use 10x wax, which is, as you can see at room temperature, you can fold it. And I fold it over so that there's 2 thicknesses. And then I'll take some scissors and cut the basic arch form. You take your centric occlusion bite first, because when you start taking your power centric bites, you're trying to program your patient to get the condyles seated. In centric occlusion, I don't want any programming of the patient. I want the patient to close strictly in her centric occlusion without me guiding anything, and she'll close into a very tight closure. I'm going to first just gently heat this. Just a little bit. And then I'm going to put it in the mouth. Go all the way back to the posterior teeth. I'm going to press it against the incisors. And I'm going to go all the way back to the second molar and press it over the distal of the second molar. Now you can see I have a general outline of the upper teeth with the very clear indication of the distal of the second molars. I will cut the wax bite off right at the very distal marginal ridge of the second molars. You don't want any of your centric occlusion bite extending out past the distal of the second molars, because it may hit the maxillary tuberosity and distort the seating of your centric occlusion bite on your MCD. I'm going to also trim the excess off of the buccal here on both sides, again, so that the cheeks won't interfere in any way. So I'll now then I'll heat the gently just put it into the warm water bath, get it somewhat soft, and put it back in the mouth. And I have my key. I key off the incisors. I know exactly where to seat the wax in the mouth because I have good, clear indications of the incisors as to where to place it. The water bath is fairly warm, so you don't want to leave this in here. Otherwise, it gets too soft. Okay, Erica, open for me, sugar. Press it against the upper teeth all the way around. And just have your patient close now. Close, please. Close. Keep closing. Close tight, please, Erica. Hold it. Keep closed tight on that bite all the way through it. Do we have air? Use a little air to chill it. Okay. Okay, now open, please. And you see the patient bites through, very clearly through the CO bite. I'm going to put it in ice water now. For the power-centric bite, we use Dalar Blue wax because it is very hard at room temperature. And that is very, very important, that it be a wax that is hard at room temperature. If I try to bend it, the wax will actually break. That's how hard it is. And that's what you need to do the power-centric bite. So we're going to heat it into the water bath. And I'm going to make the anterior section. And the anterior section will consist of 4 thicknesses. Now, the anterior thickness will vary depending on the overbite. If they have an open bite, you may need to have 5 thicknesses in the front. I probably could do 3 thicknesses here, but more standard we do 4. So I'm going to do 4 thicknesses because that's the usual, accommodates almost everyone. And I just fold it and roll it back to 4 thicknesses. And there's not much anterior posterior thickness because I don't need it. There's hardly any overjet. And we cut off the excess. And then I trim the width. And now I'm going to just very gently put it in the mouth and have her close a little bit. Stop. Open. And make sure she's touching the lower incisors are touching my wax. Open. And so what I'm doing is adjusting the anterior posterior positioning of my anterior section of my power centric. I'm going to press it against the upper teeth a little so that I get a slight indentation.
All right.
It's very important that you incorporate the upper cuspids in your anterior section. That prevents any wobble of the anterior bite if you had it just on the incisors. So this stabilizes the cross arch when you have both cuspids on the upper incorporated in your wax bite. You want your patient at the proper height, number one. For me, I want my forearm parallel to the floor. So I want the height of the patient so that my forearm is parallel to the floor. I want to come from the right front of the patient so that my arm is centered over the patient like this. I don't want to come from the side because you tend to put a lateral force on, and I want a controlled force in a vertical direction. So I want to have my patient in this position. I'm going to place my index finger, my second and third fingers underneath the mandible, trying to go back to the gonial angles, and the thumb will be on pagonion. When I ask the patient to start to close into the wax bite, I will put pressure lifting on the gonial angles and pulling down on pagonion so that you put this type of action on the mandible. You're trying to seat the condyles up and forward, and so by putting pressure lifting on the gonial angles, you're lifting them vertically. By pulling down here, you're creating a firing of the external pterygoid, which tends to seat the condyles in a forward position. So we pull down and we lift on the gonial angle. Now, some patients will kind of resist that hand position, and you have to test your patients to see how well they cooperate with you. Sometimes a patient will work better just by placing your index finger underneath the chin and your thumb here, and you lift with this finger and pull down with your thumb so that you get this type of action. So some patients will work better here than here, and so you have to test your patients. Secondly, again, because I have a small hand, sometimes I can't span the mandible good, and so I have to use this position. Patients with very thick necks, you have to be careful not to get them choking your patient. So each hand position, each patient, you have to work with them for a moment to determine what works best for this patient. So I'm first going to try this technique here, and I'm going to ask her to open, and I'm going to have her close, stop. Open a little bit, stop. Now close until you touch first tooth. Open, close slow. What tooth touches first? Open. Now, which side touched first?
Yes.
Okay. So the first thing I did was ask the patient, which side touches first? Her right side touches first. The reason I want to know that is because when I start closing the patient, I'm going to be watching the right side because I know that's the first contact. I want to stop the patient approximately 3 millimeters short of the first contact. And so that's the reason you want to know which side touches first. She seemed to work pretty good in this hand position. Now, as we do this, it'd be difficult for me to talk about it as I do it, but don't put pressure on the patient until she touches the wax with the lower teeth. If you start putting pressure as you try to close them, they start resisting. So wait until they touch the wax with their lower front teeth, and then you do your lifting and you bring down. And you get that final bit of seating of the condyle in that manner. I'll make my posterior section. Posterior sections, normally two thicknesses is adequate for most patients. So we heat it gently. And I want to cover the 6-year molars and the second bicuspids. So that's approximately width I want of the posterior section. Cut off some excess. Now, when you have your models, go to the distal of the first permanent molar, both sides, press gently. And you see I have an indentation of the first molars and the second and first bicuspid. So I'm going to cut off now the excess on the buccal and a little bit of the excess in the anterior segment. Now, if we can see in the mouth, I've cut right at the buccal face of the teeth so that when I start to take the posterior section of the wax bite, you can see that I'm resting on the teeth, the buccal of the teeth with part of my fingers and thumb, and I'm also holding the wax. The wax is cut to that width so I don't squeeze the wax and distort it. The teeth support the width, and I'm not distorting it. Okay. Okay, now relax. Now close a bit. Close, 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 close. Stop. She's touching the wax. Now I put pressure. Close slow. Close slow. Close slow. Close slow. Stop. I'm watching the second molars on the right side. When they, there please. When they get to be 3 millimeters apart, I stop the patient in closing. A little air. Use some air. Initial chilling. Thank you. Now open. Very carefully take it off so you don't distort it. And put it in ice. And the way we check it is put it back in the mouth. Now, if we take a look at our bite, this is pretty deep indentations here, so before we use this to mount models, we'll actually have to trim away some of this excess. The lower is pretty good. We may trim away just a little bit there, but the lower is not too bad as far as the depth of the indentations. But I'll put it back in her mouth. Okay, so we're going to check our bite to see if we did a good one. And so we'll put it back in. We'll have the patient open a little bit. Close now. Close slow. Close slow. Close slow. Close slow. Open just a little. Close. Hold it a minute. Now open a little bit. Relax. Just let go. Just let go. You should be able to manipulate the jaw pretty easily and get a good pop. I'm going to take another one. That's not too bad, but I don't like the sound yet in that one. So I'm going to take one more anterior section, or centric bite. Now relax, close, open. There. This one is better. The first one I took. Did you? I don't know if you could hear that or not. You want to hear a pretty good tap into the bite. So I have to heat the posterior section. Again, I have to watch the water bath carefully. Place the posterior section distal of the first molars. Press it against the upper teeth slightly. Place your anterior section. Close, close, close. Have your patient now hold firm against the anterior bite. Hold firm. Don't move. Hold firm against the anterior section, hold firm, and use air to cool the posterior. It's best with an assistant to retract the cheek. And you should hold on. The doctor should continue to hold the mandible. Okay, now hold this a minute. I'm going to use it again. Open. Take out the posterior, or the anterior, I mean, and chill the posterior again, cross arch. Gently take it out. And put it in ice water. Action. As good as we did the anterior. Now close. Open a bit. Close. Relax. Open. And we want to take our Facebow now. And we've prepared our Batfork with the compound tabs on it in the incisor and the molar area. Her upper midline looks pretty well lined up skeletally. So I'll line up on the central incisor midline this center line of the Batfork. Sometimes if the upper incisors are off to the side, which they can be, now you've got to use the philtrum of the lip. That's one of the best guidelines to the center of the face. And hold it like so. And we're just going to rotate it into the mouth like this. Line it up on the incisor, on the midline, and press gently against the upper teeth. And that's the way we're going to take our Batfork. Now I have to soften the bat tabs. So I'm putting the Batfork in the water bath, and I'm going to soften the compound tabs. And we want to get basically cusp tip indexing so that we tripod our model. And that will stabilize the model. When we have 3 points of contact like that, I'm going to chill the tabs and double check it. See if it fits good. Which it does. Now, what's very important at this time, if you've overseeded and you have too much indentation of the cusp into the bat tabs, you have to take a sharp scalpel and trim away the excess compound because you want basically cusp tip indexing to see the model. But to illustrate what I'm talking about, I will trim just a little bit to illustrate it. It's important that you trim at this time because if you start trimming, sometimes you can knock the bat tab off and you have to start over. And so if you've gone to the lab and your patient's gone home and you decide to trim it, now then you've wasted your time and the patient's time. So trim it now while the patient's here. I'm going to trim it underwater because otherwise the compound tends to fly around too much and make a mess. So I'll trim a little bit. And now since I do have a model, I can go ahead also and try to seat my model into it to see if the model seats good. If not, there could be two problems. Maybe this is distorted or maybe this is distorted. And so you want to double check that when you can. Now the other thing, and I think you can see it easier with the model rather than me going to the patient's mouth. You must make sure that only teeth touch the compound. If the teeth touch the metal, you have to start all over. And sometimes your bicuspid, if you have an extruded bicuspid, it may hit the metal. And so you look at it, you put model on, and you look and you check to make sure that no teeth are touching the metal.
Tilt it down just a little bit more. There you go.
We're very, very close here, but I can see a small space at the second molar. To do the Batfork for a hinge axis Facebow, the condyle has to be eccentric. Therefore, we have to use another method of holding the Batfork against the upper teeth. Again, I'm going to use this morning some Beauty Pink Extra Hard Wax to do that. One thing that you want to check when you get ready to do this is what is the relationship of the lower teeth to the Batfork when your patient closes into centric. So I had to put the Batfork in the mouth, have the patient close slow, stop. What I'm looking for now is where are the lower molars. Close a little more. Open, close. Okay, close. She touches the Batfork at this vertical. Open, close, slow, stop, close. And she's touching the Batfork now. I don't want her to touch the Batfork. So what I'm doing is looking at the relationship of the lower incisors to my Batfork to know just how far to close her down and where to place my wax. Right there. Okay. Put it on the bottom of the Batfork. Press it down a little bit. Lock it over the Batfork edges. Now relax and close. Close, close. Keep closing. Close, close, close. Stop. Okay, so what I've tried to do is put the condyles eccentric. Close her down. I'm holding the Batfork in place, but I'm holding on to it for two reasons. One, to keep it in place, but one also to feel. If her lower teeth were to hit the Batfork, I could feel it. I can't see it, but I could feel it. So you want to hold on to that Batfork and so that you have a good sensation of touch with the patient. Now you can see the Batfork is in place. My hands are free. I'm going to call on my assistant to put the Batfork in the ears. You want to have this just slightly loose so that so he's going to start putting it slowly in and make sure your toggles are loose, as I told you before. And you want this part of the toggle, this slit part of the toggle toward the stem here. And as he goes slowly toward the ears, I'm going to slide this over the Batfork. Now, notice I'm going to control this Batfork assembly with my left hand. And I can change the vertical here, and I'm still controlling this area here with my left hand. I'm trying to line up the Nasion relator with the Nasion. And now, once the assistant has it into the ears, they push in and forward. I tighten the width. The assistant continues to hold the Batfork so that when I tighten the Batfork assembly here, it will not lever or torque on the patient's ear. I'm going to release the Nasion relator and let it go back against Nasion. I'm going to use this like a plunger. I'm going to place my index finger here, and I'm going to push like this. And I'm going to push back and use my index finger to tighten here, and then slip up and tighten. Good. And now come to the toggles in the front, and I'm using again my left hand to support everything to resist the torquing as I tighten the toggles. I tighten it on the Batfork stem first, and then on the vertical post of the assembly next. And then come back. Tighten again. Now, at this point, all I have to do, I don't have to mess with this. I don't have to worry about the nasion relator. Just release this. The assistant opens it up, and the patient opens, and we lift it out of the mouth. Okay. Now, the next thing you want to do is you want to check and see, make sure you tightened okay. So gently try to move the Batfork. Not real hard, but gently. And so it's tight and tends to stay in place. The next thing I want to look at is I want to close the ear bow, and I want to look at my indentations of the compound and relate it to the Batfork ear bow here, and see, does it look symmetrical? Do things look symmetrical to me? The next thing I want to look at is I want to look from here, and does it look relatively symmetrical? Because maybe I missed looking at my patient closely, and my patient may have some asymmetry that I missed. Sometimes you can see it here. So it's kind of a double check of your patient and your initial exam. Did I miss anything? And so this looks like it's okay. And so we are ready now to dismiss our patient and go to the lab and do the mounting of the models.